Okay, so I'm gonna do a demonstration blood draw on my sister. So basically when I enter a room, I usually knock first, and then we have this thing called AID IT, acknowledge, introduce, duration, explain, and thank. So first acknowledge, I'll be like, hello Paige, or good morning Paige. Then I'll introduce. So hi, I'm Faith from the lab. I'll be getting some blood from you. Then duration, we don't always do this, but sometimes we'd be like, oh, this will just take a second. But most patients have been poked like 10 times, so they're pretty used to it. And then explain, you just explain what you're doing, like I'm washing my hands. I already washed my hands, by the way. Make sure you do that first. And then once I come in, I'll identify the patient. We have these things called rubbers, which I talked about earlier. They have our charting system, so we just scan their bracelet, make sure we have the right patient, all their tests pull up, and then we'll ask them for their name and birthday. She'll say Paige Johnson, her birthday. And then we're ready to go. So usually I'll put on gloves after I clean my hand. Exhilarating process. Okay. And then I usually set up all the stuff besides my needle, because I'm usually not for sure what needle I'm going to use. They might have hard hands, so I have my gauze here. I open my alcohol wipe, and I put, these are different Band-Aids than I usually use. Alright, and then I get my Band-Aid, and then I usually put that on my left hand, so then I can easily put it on the patient. Alright, and so then I usually also get my tubes. I usually have a tray of a whole ton of stuff that I can pick from, so I just have a couple tubes here that we're going to use. And then I take a look at the patient's arm. Usually I check if there's IVs. If they have an IV, obviously you can't draw where it is, but if it's on, you can draw underneath the IV, but if not, you can usually get a nurse to pause it, and then you can draw above it. So I'm just going to go here since she doesn't have any IVs. Then you tie the tourniquet on. And then this is called palpating. I mean, obviously you can see your vein right there, it's pretty big. But also if you don't see a vein there, you can also look on hands. And sometimes we poke their fingers if they really have no veins, but she has a good one here, so we're just going to use this guy. Okay, so I'm going to use a straight needle, is what this is called, because it's a pretty straightforward vein. So what I'm going to do, just take off this plastic part, screw this on, we're ready to go. I like to put my gauze up here, so then I always remember to take off the tourniquet once I'm done. So then I'm going to just clean the area that I'm about to poke. Make sure you let it dry. Then you pull the safety back, which is this pink thing. Take this green thing off. Share of your tubes. I usually put them in the right order, so I know what to do. Alright, and then you anchor the skin, because it's like when you're pulling a string. If you pull it tight, it won't move as much. Pull this back, and then this is called the secret. And then you also anchor that on so you're not moving it while it's in her. Then I'll do 3, 2, 1, poke. Then you just put the tube in. These ones, you only need about 1 ml to fill, but I just fill them as much as I can. As long as they're running. Just the second one, on the last one, you always take off the tourniquet. Take the tube out. Take my gauze. Pull it in fours. Pull straight out. Gauge the safety. And put the Band-Aid on. Then we're all done. You invert these. Usually 8 times. And then I'll usually have a printer here that prints off the labels after I scan her with a rover. And then I put those on so lab knows what tests are for and who they are for. Then you put them in the bag, and before you send it, you always double bag. These are stat bags, but it all depends. If it's stat, you put it in a stat bag. If it's not, put it in a regular specimen bag. Then it's good to go. For this segment, I will be discussing all the skills that I've learned and kind of charting them out, and then talking about how they relate to my future career, whether that's in medical school or just in medicine in general. So I've kind of divided it into 3 categories here. I have the technical skills I've gained, the workforce experience I've gained, and then also the soft skills that I've gained. So first I'll start with the technical skills I've gained. A big technical skill I've gained is just procedures on patients in general. Although I'm doing kind of a basic one, it's kind of a segue into maybe more complicated procedures that will be helpful in a career in medicine. And then there's also just general medical practices in general. For example, HIPAA, wearing PPE, a charting system. The one we use is Epic. And throughout any medical career, you're going to see these things pop up no matter what you do. It's kind of universal and it's applicable to everything in healthcare. So this is very helpful, just getting familiar with that for a career in healthcare. And then kind of the last skill for technical skills is just picking up on the medical language in general. For example, in my job specifically, I get to learn all the test names and the purposes if I'm curious about it. And that's pretty important in the medical field since 70% about of treatments are determined by blood tests. So it's a big part of the medical field. And then there's also just the surrounding language in general, like listening to doctors and nurses explain things. For example, I've heard terms like MPO, protonics, which that just means the patient can't eat or drink, or protonics are used if the patient's stomach is upset, and just a lot of things like that. The next subcategory I have here is workforce experience. Just working in the hospital environment is kind of helpful for my future career since it gets me a lot of exposure to the different kinds of jobs and the equipment and everything, which medical job exposure kind of ties into that. Just seeing like what the nurses do, what the doctors do, and I've kind of gained a little better idea of what I want to do, like in the medical field specifically. And then also with workforce experience, working difficult hours and volumes, just like hard work in general. That'll be helpful for things such as residency and medical school. Those aren't necessarily easy, so this job is kind of preparing me for that. The soft skills I've gained, the main thing I've gained it through is through patient interaction. For example, like just those interpersonal skills, like dealing with patient sensitivity, creating a safe environment for them so they feel comfortable, exposure to kind of different illnesses and diseases. For example, getting to deal with people that have like Alzheimer's, you kind of take a different approach to that than other patients. So just being able to learn from different people, which can help me prepare for that when dealing with patients in my future career. And then there's also kind of patient understanding and empathy, being able to put things in a way that patients can understand. They're not expected to be experts in the medical field, so kind of empathizing with that.
The next medium I've gained soft skills through is through coworker interaction, whether that's teamwork, compassion. In my job, we always work as a team to get things done. And I think that's any job, especially in healthcare. We all need to work together to meet the common goal of um, caring for patients as best as we can, and then also just having compassion for each other and making sure we're taking care of each other. And then the last kind of area here is soft skills. I've learned just overcoming my own obstacles. I've gained a lot of resilience, accountability, empathy, all these skills that um, are just what you learn from overcoming obstacles in general. And life is always going to have obstacles. My career is always going to have obstacles. So that's pretty important for my future career. Overall, I've learned a lot from this job, a lot of things that are going to help me in my career because it's really directly tied to healthcare, and I'm excited to learn more.